Medicare approved, they're Medicare approved policies that are sold by insurance companies, and they help pay for your prescriptions that are not covered by Medicare Parts A or B. It includes most self-administered outpatient prescriptions. So with original Medicare, Part A covers your prescriptions when you're hospitalized, in hospice, or in long-term care for recovery or rehabilitation. If you are in long-term care for what's called custodial care, you're going to probably be living there the rest of your life. Your Medicare Part A, I'm sorry, does not cover your prescriptions. You have to have a drug plan. Part B covers prescriptions that are not self-administered. So those could be, and the majority of them are, either the medication that's put into a nebulizer, a piece of equipment that helps with breathing, or insulin that is used in an insulin pump, not a self-injected insulin. There are a few other exceptions, things. There are certain oral cancer drugs that are actually self-administered in pill form, but they metabolize exactly the same as infused drugs. But if you need to go to a medical facility, doctor's office, hospital, clinic, whatever, and get a medication infused or injected because you cannot inject yourself, then Part B will cover it. So how much does it cost? In 2022, there are 30 plans available in our area. They have monthly premiums between $7 and $93. Most have annual deductibles, but they cannot charge more than $480 in 2022 for your annual deductible. They have co-payments once your deductible is met. They have to cover at least 2 drugs in every class of drugs that's used by most Medicare beneficiaries, but they do not have to cover every drug. The plan costs and coverage can change, and you can change plans every year. Unlike your supplements, those of you who were with us for Parts A and B and Medigap understand that changing your Medigap plan is risky. You have to make some decisions. This is very much a case of you really need to take a look every year. So co-payments. We've talked about premiums anywhere from $7 to $93. How much are the co-payments? So all the plans have a formulary, and that's the list of drugs that they are covering. And they divide the formularies into several tiers. Tier 1 is the cheapest. It's most generic drugs, but not all generic drugs. Tier 2 is preferred brand name drugs and some of the more expensive generics. Tier 3 is non-preferred brand name drugs. They have a higher copay yet. And then there's specialty tiers. Some drug plans just call it a specialty tier. Some plans also have tiers 4, 5, and 6. These are the very high cost drugs, and they have the highest copays. When you start investigating prescription drug plans, you're going to see prices quoted for copays. Those are for a 30-day supply. So if you get a 90-day supply, just multiply whatever that cost is by 3, and you'll get what you need to pay at the drugstore every time you have your prescription filled. So who's heard about the donut hole? All plans have several coverage stages. So the first stage is the deductible stage, then the initial coverage stage, the coverage gap stage, and the catastrophic coverage stage. We're going to talk a little bit about each of those. So in the deductible stage, you pay 100% of whatever the plan's negotiated price for the drug is until you reach your annual deductible. So you may pay the first $480 of your prescriptions until you've reached your deductible for that year. Once you've actually reached your deductible, then you're in the initial coverage stage. And then you're going to pay the copayment that's listed by your plan for your prescription. A word of warning, the amount of your copayment may vary depending on which drugstore you use. The plans contract with drugstores, pharmacies. Almost all are part of chains. So it's CVS, Walmart, Costco, Rite Aid, Walgreens, to be part of the plan's preferred network. Generally, if you use a pharmacy in the plan's preferred network, you're going to have slightly lower copays. And when you investigate these plans using the Medicare Plan Finder, it actually allows you to put in up to 3 pharmacies and gives you the different costs at those 3 pharmacies for each plan for your particular drugs. Then you get to the coverage gap stage. This is what used to be called the donut hole. So in 2022, when you get drugs, no matter whether you paid for them or your plan paid for them, the total $4,430 in a calendar year, you go into the coverage gap. And while you're in the coverage gap, you're going to pay 25% of the cost of the drugs, whether they're generic or copay, and 25% of the dispensing fee. So this is a huge improvement over the original drug plans. In the first years, when you reached that limit, you had no coverage until you reached catastrophic coverage. It is much better now. And then once you alone have spent $7,050 for drugs and the monthly premiums in the calendar year, you enter catastrophic coverage. And while you're there, your copays are 5% of the cost of the drugs, or $395 for generics and $985 for brand name drugs, whichever is greater. And again, that's for a 30-day supply. We do have clients who are on very expensive medications who go into and out of the coverage gap by April, and they are in catastrophic coverage for the rest of the year. We have others who never make their deductible because they're on cheap medications. So let me stop for a minute and see if anybody has questions. If you do, remember to unmute yourself. Okay, hearing none. Covered vaccines. Plans must include most commercially available vaccines, including the vaccine for shingles, in their formularies. But there are a few vaccines that are covered by Part B, and that is flu, your annual flu shot, pneumonia, and there are now 3 different kinds of pneumonia vaccines. You must have 1 year in between each type of pneumonia vaccine for Part B to cover it. It covers the vaccine for hepatitis B, and it covers all COVID vaccines and boosters. Other than that, your vaccines. So your doctor recommends, as mine did, there is whooping cough in the community. I would really like you to get a Tdap vaccine, which is tetanus, pertussis, diphtheria. That would be covered by my drug plan. Insulin is another big issue. All plans must offer both short-acting and long-acting insulins, but they're not required to offer all of them, not all the brands. So in 2022, 13 of the 30 plans in our area have chosen to participate in something that's new this year called the Insulin Savings Model. And that caps your cost for insulin at $35 a month for each type. So if you use both short-acting and long-acting, you're going to pay $35 a month for each of those types. Now, any insulin that's delivered by an insulin pump is covered by Part B, and all of your testing supplies are covered by Part B. And your supplement, because remember, Part B will only pay 80% of the cost. So what if you get a new prescription? When you start to look at these plans, you're going to have a list of your drugs and their strength and the frequency with which you take them. And you're going to, if you use the Medicare Plan Finder, put those into the program, and it's going to give you pricing in various plans. So what if partway through the year, your doctor gets a new prescription, or stops a prescription, or changes the prescription? Instead of taking 10 milligrams, you're now taking 15 milligrams. As long as that drug is in the plan's formulary, it's going to be covered. When you enroll in a plan, they're going to send you the formulary. It's a great big book on cheap paper in tiny print. Excuse me. But when you get a new prescription, it's always a good idea to check it, to make sure that it's in their formulary before you fill it, so you're not surprised when you pick it up that this is, druggist says to you, that's $747. And you say, but it's insulin, not on their formulary. So it's a good idea to check the formulary, especially if your doctor says to you, I think that this new brand name drug would be a good choice for you. Check it first. You may still want to take it, but you may have to pay the full price for it. So what's not covered? Certain drugs are excluded by law, and those are listed here to treat anorexia, weight loss or weight gain, promote fertility, cosmetic purposes, or hair growth. For some reason, if the drug is used only for relief of cough or cold symptoms, it is not covered by law, or used to treat erectile dysfunction. Also excluded, and this confuses lots of people, including me, are prescription vitamins and minerals and any over-the-counter drugs. Over-the-counter drugs, I understand, but if you need a prescription to get a particular vitamin, common sense tells me it ought to be covered, but it's not. So there's a couple of other rules that happen here as well. The plans have the option to require prior authorization. So if your physician, your healthcare provider puts you on a prescription that is, say, unusual or has street value, and the prescription is for a lot of pills, they're going to require prior authorization, and your physician is going to need to submit a form to the plan stating why he or she thinks that you need this drug and that it's medically necessary. They can also put quantity limits on your prescriptions. They do this most often with either opioids or with drugs that have street value. And believe it or not, some of the anti-cholesterol drugs have street value. What they don't want is someone filling a prescription and then reselling it. Obviously, with opioids, there's a different reason for putting quantity limits on. And then step therapy. And this can get frustrating. There's less of it going on now than there was, but it's still frustrating. If your cholesterol is high and your doctor says, I'd like to put you on rosuvastatin, which is the generic for Crestor, that generic is still expensive. There are other anticholinergics like atorvastatin, which is the generic for Lipitor, which are much cheaper. The plan may require that you start with atorvastatin, and if it does not do the job, that you are then going to be allowed to move to rosuvastatin. As I said, there's less of that going on now because it takes time on their end, which is money, but it is a possibility. Can I get my prescriptions at any pharmacy? As long as the pharmacy accepts the plan, yes, but not every pharmacy accepts all plans. So you need to check. Some pharmacies, as we talked about a little earlier, have agreed with one or more plans to be part of the preferred network, and your costs could be lower. One of the things you need to think about is, are you wed to your pharmacy? That's the only pharmacy you want to use. Or do you absolutely detest this particular pharmacy? You had a bad experience there and you never want to use that pharmacy again. That's going to weigh in your decision about which plan you choose as to whether or not the plan is in a preferred network or a network at all. So I'm going to stop again and see if anyone has questions.
Jerry,
Yes.
is the $480 deductible by drug or a total across all drugs?
Total across all drugs. So your out-of-pocket cost is all drugs.
Okay.
Anyone else? Okay. When can you enroll? You must be enrolled in at least Medicare Part A to enroll in a prescription drug plan. You do not have to be enrolled in Part B. Some people who are still working and have employer group health coverage choose to enroll only in Part A so that they're in the system, but actually enroll in a prescription drug plan because it gives them better pricing than their employer's plan. Now, if you're new to Medicare, you can enroll in a plan during the 3 months before, the month of, and the 3 months after your Medicare coverage becomes effective. That's generally your birthday month, but not always. Depends on if you're retiring after 65, it could be when your employer group coverage ends. The thing to think about here is, yeah, you can enroll 3 months before your Medicare becomes effective, but you have to have a Medicare number. You can't enroll without one. So that's another reason to enroll as soon as you can in Medicare once you know that you're enrolling. Now, after that initial enrollment period, you can switch plans every year in the fall for the following year. So I don't take any drugs. Even though the cheapest plan is $7 a month, I don't see any point in spending $84 a year for something I'm never going to use. You might want to rethink that, because if you don't enroll in your initial enrollment period, you're going to have a late enrollment penalty unless you have creditable coverage through an employer group health plan and you are actively employed. COBRA does not count. Also, if you don't enroll when you're first eligible, you're going to need to wait to enroll until the next open enrollment period in the fall. And that coverage is not going to be effective until the following January. So how much is it? It's 1% of what's called the National Base Beneficiary Premium. That's pretty much the average premium nationwide. That number in 2022 is $33.37, multiplied by the number of full months that you were not enrolled. And that amount is added to your monthly plan premium payment, and it goes on forever. You will never lose it. The National Base Beneficiary Premium also is calculated every year, and it usually goes up. So it might be 33, 37 this year. Next year, it might be 34.52. So here's an example. Your Medicare becomes effective in April. You don't have creditable coverage, and you don't enroll by July 31st. So that's the end of the third month after the month it became effective. In February of 2023, your doctor puts you on a prescription that's expensive, and you decide you want prescription drug coverage. First, you won't be able to enroll in a plan until that fall, with coverage beginning the following January. So you're going to have close to a year of no coverage anyway. And your penalty will be 37 cents times 17. The 5 remaining months from August through December of 2022 and the 12 months of 2023. So that's $6.29 a month added to your premium forever, or $7.50, depending on when we first started this 17 years ago. The late enrollment penalty was, instead of 30 cents, was like 15 cents. So be aware of what the penalty is if you do not enroll when you're first eligible. I'm going to stop a minute because the late enrollment penalty can be confusing for people. Does anybody have a question? Okay. So how do you choose? You can get help from your insurance agent. You can contact one or more of the plans directly. The plans that are available in our area are listed in the back of your My Medicare book that comes out every year. You can use the Medicare.gov plan finder. You can call Medicare, or you can schedule an appointment with one of us at VPAS who are Medicare insurance counselors and certified by the state. And we have counselors throughout the 6 counties, 5 counties and 5 cities that we serve. This is the Medicare Plan Finder. You go to Medicare.gov and it asks you to log in. Just forget that and go down to where that blue arrow is, where it says Find Plans, and click on there, and it'll walk you through the questions to find a plan. It's not difficult. It's a little time consuming. It helps if you know exactly what the name of your drug is. And there are some tricks to using it, but it's fairly straightforward, much more so than it was, again, a long time ago. Now, if you put in the first 4 or 5 letters of a drug, it gives you a list that you can choose from. When we first started, I never knew I was going to have to learn to spell hydrochlorothiazide, but I did. So here's what you're going to need to know when you start to compare plans. You're going to need a list of your prescriptions, including the name, the dosage, and the frequency. And you're going to need to make that decision, or at least think about that decision, about whether there's a pharmacy you want to use or a pharmacy that you really don't want to use. Once you enter all the information, or we enter all the information, or you call Medicare on the phone or you go to an insurance agent, you're going to get some comparisons of plans. And there are things to look out for in the comparisons of plans, but we're not going to get that far in the weeds today. So how do you enroll? You pick a plan. You can call them up. You can go to their website. You can enroll through your local insurance agent as long as your agent sells that plan, represents that plan. You can enroll yourself on the Medicare.gov website, or one of us here at VPAS can help you with the option of enrolling online. When you enroll, you'll be given the option of having your premium billed to you directly or deducted from your Social Security retirement or railroad retirement check. I strongly recommend that you have the premium billed to you directly. Social Security and railroad retirement really don't want to do this, but they're required by law to do so. There's a lot of information that has to go back and forth in order to verify an enrollment in a plan, verify the premium, verify whether or not there is a late enrollment penalty that is attached to the premium. And what happens is you could be paying last year's premium for 3 or 4 months before it all catches up. And if the premium from one year to the next went up, you're going to pay the whole difference in the first check where it catches up to your Social Security payment. One, if you choose billed directly, your plan will send you information about how you can actually do this with an automatic withdrawal from a bank account, an automatic charge to a charge card, or they will send you either a monthly bill in the mail, or some of them send a payment booklet, like the old car payment booklets. If they send you a payment booklet, here's a tip. Look in the very back, at the very last coupon in the book. Some plans that use these booklets will have a 13th coupon, and it says if you pay for the entire year, you only have to pay for 11 months if you pay for it all at one time. But they don't advertise it. So look in the back of the book. So you enroll in a plan and you decide you've picked a limit for whatever reason. They're being picky about prior authorization. They're being picky about quantity limits. They're, for whatever reason, you just don't like the name, whatever. You can switch plans once a year, but don't cancel your plan till you've enrolled in another one, or you're going to incur a late enrollment penalty for the months you didn't have coverage. So if you decide in March that I really made a mistake, I don't like this plan, I'm afraid you're stuck with it through the end of the year. But 1st of October, call us up, make an appointment. Let's see if we can find you a better plan. If you're having real problems with a plan not paying, or a plan that stops paying for a drug that they had been paying for in the first place, our Medicare insurance counselors can help you appeal that decision and go through the forms. It really is important to compare plans each year. We have some horror stories about plans that changed and auto-enrolled. For instance, last year in 2021, there was a plan that was about, I think it was $14 or $16 a month. It had really good coverage, and we had lots of clients enrolled in that plan. For 2022, the company discontinued that particular plan and auto-enrolled everyone who was in that plan and didn't make a change during open enrollment into a different plan with a very similar name that was $40 a month and had no better coverage. So it really is important, A, to read the stuff that they send in the mail, and B, to actually do the comparison every year. We often can help you save money, sometimes a lot of money, sometimes not much, but you'll have the peace of mind knowing, even if we can't save you any money and you stay with your plan, that you've got the best choice for you. Any questions before we go on to extra help? You guys are quiet today. You're just trying to get out in that good weather. So there are subsidies that can reduce or eliminate premium payments and reduce co-payments. And to qualify, certain income and asset limits must be met. These applications are accepted and processed throughout the year, and you apply through the Social Security Administration, not through Medicare. This is not, and we work very hard to help our clients understand this, this is not tax dollar money. Part of the Medicare prescription drug plan law says that the manufacturers of drugs must help to make those drugs available and accessible to people with lower incomes. So this is actually being paid for by the manufacturers. To qualify for full or partial extra help, and you can qualify at 25%, 50%, or full extra help. Your annual income must be below $20,385 for an individual, or $27,465 for a married couple that's living together. And your resources must be limited to $15,510 for an individual, or $30,950 for a married couple living together. However, not all of your assets are counted. These are counted: bank accounts, stocks, bonds, mutual funds, liquid annuities, retirement accounts, the value of your vacation home, and any cash you have on hand or anywhere else. These don't count your primary residence and the land it's on, as long as they're in one tax plat. If you own a farm that's 50 acres and your house is on that farm and it's all part of one tax plat, none of the value of that land will be counted as an asset. Any personal possessions, including your vehicles, any jewelry, any coin collections, stamp collections, those sorts of things. If you have rental property and you need the income from that to support yourself, the value of the property doesn't count, but the rental income will count as income against the income limit. Does not count the cash value of life insurance policies, and it does not count the value of annuities that were purchased solely to cover burial expenses. So you go to the Social Security website to apply. You can call them and request that. I would just say, can you send me the extra help form? But it is form SSA-1020. You can apply at your local Social Security office, or you can arrange an appointment with one of us, a Medicare insurance counselor at BPAS, and we can help you apply online. It is a very simple application. It does not require proof of income or assets. It asks you. Now, understand that Social Security can get into and does a lot of information about you, and they exchange information with the IRS. So it doesn't pay to lie. We also found that they do ask you for, do you have any, what's the value of your cash on hand? If we put down 0, it's almost automatically going to be denied, because they figure everybody's walking around with $2.13 at least. So we put down, even for our folks who are very, very low income, we will put down $5 because it greases the skids, frankly. So let me go back to extra help. Extra help is available to far more people than take advantage of it. even if you know that you won't qualify for extra help. You may have a family member, a neighbor, a friend, someone at church who may qualify. You do not have to be at the federal poverty limit in order to qualify for this. And the average benefit to people is calculated at somewhere around $5,100 a year if they get extra help. So please refer them to us, to the Social Security website, the Social Security office, to investigate whether or not there's a good possibility you can qualify for extra help. Even with people who are kind of on the edge of either income or assets, we generally file the application or encourage them to file the application, because sometimes for whatever reason the government chooses, they will approve it. They will only approve 25%, but it's better than no percent. Questions on extra help? Okay, that's pretty much the end of Medicare prescription drug plans. There are lots of little nuggets of information that we have learned through experience. There are ways of potentially staying out of the coverage gap or the donut hole. There are ways of figuring out whether or not a drug that you take that seems to have a very high copay might be available at a cheaper rate using another method, and not your Medicare drug plan. But that's kind of in the weeds. And it really is a case-by-case, very personalized assessment of what's in to your best advantage. So I am happy to answer any questions that you have. Just remember to unmute yourself. Who's
There's no
confused?
questions in the chat box.
Thank you, Hillary.
I have a question, just 1 second.
I think that may have been Lena, but you need to unmute yourself.
Oh, yeah, sorry. I had someone in the room with me who was asking me the question. She was saying that the plans in the back of the Medicare book they receive, are those the only plans in the area, or are there other ones in addition to those?
That is it. All of the plans are offered by zip code. And it is the most bizarre situation. I happen to be in Rockbridge County. And even though Botetourt is not part of our official coverage area, we have clients from both Botetourt and Amherst County coming to us because they are in some different district, according to the drug plans. They have access to plans that we don't have access to. We have access to a few plans they don't have access to. But what's in the book is what's available. And it changes year by year. Did that answer your question?
Yes, it did. Yeah, I think she has one more.
Yep.
Could you tell us, did you say, Jerry, did the generic medications or generic brands of prescriptions, they do count your deductible or they do not count towards your deductible?
They do count. Everything you pay out of your pocket to pick up a prescription counts toward the deductible. Now, this is getting into the weeds a little bit. There are a few plans that will allow a few cheap generic drugs, especially maintenance drugs, to be purchased without meeting the deductible. but that is something that changes very often. And I really don't want anybody depending on that until they've done a plan comparison. But yes, everything that you pay at the drugstore to pick up a prescription counts towards the deductible.
Thank you.
Anyone else? Well, June 14th is Medicare Advantage plans. And June 26th is the various enrollment periods and the fine print. If you haven't registered and you're interested in doing so, please go to vpass.info/education. While you're there, take a look at some of the other stuff that we have cooking. There is a program that's coming up fairly soon, like maybe next week, that is about downsizing. We've got some other things going on, not just straight kind of Jerry droning education, but some fun stuff. So check out the calendar while you're there. Thank you all for joining us, and hopefully we'll see you in a month. Hillary, you can stop the recording.